For Body Chemistry Associates and Health Connection Radio, I'm your host, Nutritional Biochemist, Jay Foster. Well, February is Heart Month because of Valentine's Day, and we have several topics talking about nutrition's relationship with the heart. Today I want to tell you about homocysteine. For those of you who haven't heard about it, it's something we test everybody that comes in our door in a 50-panel blood test. We include homocysteine. And I was fortunate to have been able to interview the author of the book, The Homocysteine Revolution, back in like 98. Dr. Kilmer McCulley, medical doctor, who's a pathologist at the VA in Providence, Rhode Island. He graduated both Harvard College and Harvard Medical School. And he's credited with one of the major medical and scientific breakthroughs of this century, and that was the discovery of how homocysteine, more so than cholesterol, raises your risk of heart attack and stroke, arteriosclerosis. And we owe Dr. McCulley a lot because he was basically kicked out of Harvard Medical School. They told him to go away because he wasn't working on cholesterol and statin drugs, but he was working on something that is controlled by B vitamins, primarily folic acid, but also vitamin B12 and vitamin B6, which is probably why your doctor really may not know about homocysteine. They're not taught about it because there's no drug to treat it, there's no insurance code, et cetera, so they have to really learn about it on their own. Elevated levels of homocysteine are associated with an elevated risk of heart disease, stroke, Alzheimer's disease, Parkinson's disease, cancers, osteoporosis, depression, and other things we haven't even figured out yet. Lots of information about the heart that goes way back. This is from the journal called Cardiology. Hopefully some cardiologists read it in 2007. And I like pointing out old studies to show you how long we've known this stuff. I've been doing this for 42 years, but homocysteine is a recent discovery. In like 95 or so is when Dr. McCulley did a lot of his work and started putting his book together. Now he's been invited back. Now that they've proven the theory right, he's been invited back to talk at Harvard Medical School after they kicked him out. So in the journal Cardiology in 2007, serum homocysteine and long-term risk of heart attack and sudden death in patients with coronary heart disease, results showed that an elevated homocysteine level associated with a 250% higher risk of subsequent heart problems, coronary events. And folic acid, as I said, is another real big factor. And this was in the International Journal of Cardiology in 2007. The influence of high homocysteine and low folic acid levels in the blood after acute coronary syndrome. It says, listen to these numbers. Low folic acid levels were associated with more than an 800% increased risk of cardiovascular death, while high homocysteine levels were associated with more than a 200% increased risk for major cardiovascular events. The authors of the study conclude that low folic acid levels and moderately high homocystinemia, hyperhomocystinemia, identified as independent predictors of cardiovascular events. So cholesterol itself is an independent risk factor, homocysteine is an independent risk factor, oxidized LDL is an independent risk factor, magnesium deficiencies are an independent risk factor. All of these play a role. A more recent study in Clinical Nutrition Reviews in January of this year, so that was just a month ago, the effect of B12 and folic acid supplementation on homocysteine, anemia status, and quality of life in patients with MS. Serum homocysteine levels decrease and anemia status improvement with B12 and folic acid supplementation reveal the potential role of these two vitamins in improving the life quality of MS patients. So it's not just heart disease. Also cancers. Folic acid has a big role with cervical cancer and cervical dysplasia. Osteoporosis also. This is the expert reviews in endocrinological metabolism in May of 2008. Are high levels of homocysteine a risk factor for osteoporosis? They said yes. In conclusion, existing data suggests that hyperhomocysteinemia and B vitamin deficiencies adversely affect bone quality by stimulation of bone resorption or breakdown and disturbance of collagen cross-linking. So it interferes with your bones also. And for years, we've used regular folic acid quite well. And some people have a genetic imbalance in an enzyme that attaches a methyl group to folic acid, forming 5-MTHF, 5-methyl tetrahydrofolate, which is considered the active form of folic acid. So we usually include both in a multi and maybe extra folic acid, but the 5-MTHF is the activated form of folic acid and is probably the most important. So we've had clients who have asked their cardiologist, could you please test me for homocysteine? And this one guy from a cardiology practice said, no, we don't fool with that. And to hear these numbers, about 800% increased risk for heart disease or heart attack and 250% increased risk, I think they should be seeing it. And if they ever come out with a drug that controls homocysteine, unfortunately, you'll see doctors starting to test for it. Kind of like with fibromyalgia. I was talking about fibromyalgia 20 years ago, and they didn't have anything to treat it, so the doctors would just give women antidepressants, basically, or tranquilizers to shut them up. And when they finally developed Lyrica, all of a sudden they said, there's fibromyalgia. And that's the diagnosis, and the treatment is Lyrica, and it has 100 side effects. It's not a good thing to take. There's a lot of other natural ways to deal with fibromyalgia. So folic acid is extremely important, and the B vitamins, to control homocysteine. We'd like the number to be less than 8.0. Most laboratories today are saying about 10, 10.4. Some say 11. We like it less than 8. And I've talked with some of the experts in homocysteine metabolism, and they agree that it should be higher dose, and with maybe some folic acid, but mainly the 5-methyl tetrahydrofolate and good B vitamins that help to metabolize it. So the good news is homocysteine should be tested for, and if it is, we have natural ways to bring it down, usually within a month. Now, we said we like it less than 8.0. I had one gentleman come in with a 21, and he had already had one stroke, and a woman came in to us who had had 2 strokes, and her number on her homocysteine was 42. So the higher it goes, the higher risk you are for cardiovascular disease and cerebrovascular disease. Again, we test those as part of our body chem program. We test a lot of standard tests and also ones that many doctors don't do. And on our next blog, we're going to talk about CRP, a marker of inflammation, natural ways to bring that down without statins, and also the importance of fish oil and how that helps to prevent and sometimes reverse heart disease. We'll do that on our next blog, and if you'd like some more information on our programs at Body Chemistry Associates, it's our 37th year in South Florida doing this work in nutritional biochemistry and applied clinical nutrition. They do have specials for Heart Month. If you'd like to see about testing, if you've not had your body chem program of testing done, it's a good idea to find out what you need as an individual, which vitamins and minerals you need, and which vitamins and minerals you may not need. The only way to do it is through testing. 1-800-CHEMIST is our number, 1-800-243-6478. You can find us on the web at 1-800-CHEMIST.com. For Body Chemistry Associates and Health Connection Radio, this has been nutritional biochemist Jay Foster, and we'll talk to you on a future blog.